Hi everyone, this is Brittany, the Drexel Master's student that has been following Dr. Wilt this semester. I'm sure some of you have seen me around. I am going to be presenting Chapter 8 of your text to you. Unfortunately, since classes are suspended this week, I need to present it as a recording, even though I was really looking forward to the discussion we could have had in the class. Alright, let's get started. So, Chapter 8. Transcultural Perspectives in the Nursing Care of Older Adults. This semester so far, you have talked about diversity in healthcare and culturally competent nursing care. You have discussed cultural perspectives in childbearing, children, and adults. This lecture will focus on the older adult. Objectives for this chapter. You'll be able to define the older adult and the socio-demographic shift in the older adult population in the United States. You'll be able to identify socioeconomic factors and community resources that influence older adults in the healthcare system. You will be able to apply formal and informal support systems which the nurse should integrate into caregiving. And you'll be able to interpret factors affecting older adults in the healthcare system. So, nurses and healthcare professionals are caring for more older adults than ever before. This is because we have longer lifespans, and there is a growing number of baby boomers. 10,000 Americans will celebrate their 65th birthday daily now through the year 2030. And 20% of our population will be age 65 or older in that year, 2030. So how would you define old? The World Health Organization states that most developed countries define persons age 65 as an older adult. But there is no definite answer as to what age a person becomes old. One person may feel old at 75, one may feel old at 55. Along with the aging population in the U.S., we are also seeing an increase in racial and ethnic diversity amongst older adults. So diversity includes gender, sexual identity, language, education, socioeconomic status, and acculturation. You'll also be able to see various help-seeking behaviors amongst the older adults, and the nurses need to be culturally competent so that they can meet the needs of their older adult patients to achieve positive health outcomes. Cultural traditions and values affect how older adults interact within the healthcare system. Acknowledging this will help the nurse to better understand why a patient chooses to live to where they want to reside, their lifestyle, and who they want as a caregiver. So this chapter will focus on the older adult in society and factors that affect their health care, the older adult in the community and cultural influences, and the older adult caring for an individual client. So first, the older adults in contemporary society, factors which are affecting their health care. So changing demographics, there are 2 to 4 million Americans age 60 and older that are historically disadvantaged, and that includes very low incomes, higher levels of disabilities, chronic health conditions, their functioning status declines. Two of 3 older Americans have multiple chronic conditions, and 1.3 million older adults are in long-term care facilities. Chronic health conditions can lead to a decrease in ability to live independently, such as pay bills and manage their medications at home. And if their functioning status declines, there is difficulty completing activities of daily living, such as toileting and bathing. Treatment for the population with multiple chronic conditions accounts for 2/3 of the country's healthcare budget. The health status of Hispanics, Asian Americans, African Americans, Native Americans, and Alaska Natives, and Native Hawaiians and Pacific Islanders has long lagged behind that of non-Hispanic whites. Health disparities exist for a myriad of reasons, including lower income levels, lack of insurance, including supplemental insurance to Medicare, barriers in access to care, lower quality of care for some health conditions, even when the individual is insured and care is received, and individuals choosing not to seek care. It is worth talking about ethnicity and income level, as they do affect older adults' health status and need for care. Older white males with the highest incomes can generally expect to live 3 more years longer than those in the lowest income level. Older African Americans often suffer functional declines at earlier ages than white Americans. There is no simple correlation between the need for care and older age. Care needs and health status are affected by many dimensions, such as the socioeconomic level, their ethnicity, their lifestyle risk factors. Nurses should consider social and economic factors, cultural variation, and available support as all that affect illness behavior and help seeking response of the older adults. Illness behavior is defined as how individuals identify that they are ill. So, what they think their symptoms are, when they think they should seek care, and whether or not they will comply with the recommended treatment. When preparing to take care of the older adult, nurses should take into consideration the following: their ethnicity, their cultural traditions, social and economic situations, their living arrangements, employment status, and their migration history. It's also noted that older adults have lower health literacy skills than that of the younger and middle-aged adults. They are more likely to misunderstand medical tests, end up in the emergency room more often, and have a harder time managing chronic diseases. And nurses play a huge role in making sure information and instructions are understood by all patients. The cost of caring for adults aged 65 and older in the U.S. is estimated 3 to 5 times higher than for younger adults. And healthcare costs can become a financial burden to an older adult. And older ethnic adults, such as Hispanics and African Americans, have fewer financial assets than older whites, and they rely on Social Security income as a primary source of income. All right, there are a few theories of aging that we're going to review. So first, there is the disengagement theory. This theory focuses on explaining that older adults whose status is linked to employment, they perceive less self-worth in retirement than when relieved of their roles and responsibilities. The activity theory describes that older adults may substitute recreational and meaningful opportunities to take the place of a previous occupation or career. They like to be productive. They want to be involved in productive activities, and they may do volunteerism. And then there's the continuity theory, which focuses on supporting adults to remain engaged by adapting behaviors from their younger adulthood to keep them more involved in their older adulthood. And so while there are a few different theories on aging, Erikson's developmental theory, I think, is what you're most familiar with. And that is, adults may struggle with maintaining the integrity of their experience while facing the reality of declining physical and mental functions. So, individuals in this theory may show despair that, life is too short, or with old age comes less power and authority. But oppositely, there also may be joy in being the keeper of meaning and holding enduring relationships. So there could be either or. Then we're going to move on to the older adult in the community, their cultural influences. So a portion of this section focuses on the older adult immigrant. The health behavior and the illness behavior of culturally and ethnically diverse older adults is determined by their life experiences. Nurses providing care to patients with different backgrounds should be aware of these specific differences. Regional or religious identity. Why did they emigrate from their homeland? Was there a specific situation going on? War? Did their family just bring them here? The length of time that they have been in the new country that they settled in, and the degree of acculturation. Proximity to their family members. Network of friends or social support from their homeland. And do they have a link with ethnic, social, and health-related institutions? Cultural influences the older person's expectations of what an illness is and if they will use traditional sources of healthcare. Nurses should assess if patients are using traditional treatments. And this is a great example. If an older adult is using an herbal medicine that they would traditionally use, it could interfere or counteract with the medication prescribed by their physician or healthcare provider. So it is very important that this information is made known so that there is no issues between the medications. Traditional beliefs and practices and traditional preventive measures. So your text provides some examples of traditional beliefs and practices. The Somalis, they believe that illness is caused by spirit possession. The Hmong, which you guys are familiar with after reading Fadiman, they believe that illness is caused by evil spirits if one's own spirit has left their body. The Hindu believe that illness is due to karma. The Asian Indians practice Ayurveda, which is herbs and spices to treat illness. And the Chinese, of course, practice herbal medicine, massage, and acupuncture. Traditional preventive measures include religious elements, reciting prayers, burning candles, and wearing amulets. You'll see patients in the hospital that wear like saint medallions, or they have their rosary beads. So that's just something you'll see. But a few weeks ago, you all presented your cultural artifacts in class, and those fall under traditional beliefs and practices. And I'm sure many of your grandparents or older adults, aunts and uncles, still actively practice their traditions they believe in, despite whether it's helpful or not. Now, communicating with the older adult is of utmost importance. Your text has an excellent table on page 223, and it is guidelines for communicating with older adult clients. So, when speaking with an older adult, you want to elicit their views on why he or she thinks they are ill or why they have symptoms. And then you're going to ask them about their home remedies or treatments that they may have used. Like I described before, about asking if they traditional medicines because it could interfere with the healthcare they are going to get. Respond with information about biomedical model with words that the client can understand. So speaking in layman's terms. This will take some practice once you graduate because you're so accustomed to medical terms and speaking in medical terms. But often older adults will ask you to stop and repeat information in a way that they can understand. And eventually you will learn to speak to the families and patients one way and then speak to physicians and healthcare providers in another way. You want to create a positive environment. So this is really important because body language can make or break how well a conversation will go. So you want to make the patient feel invited. You want to sit close to them so maybe they can hear you. You want them to be able to see you. If you are not interested in the conversation, or if you look like you are in a rush, they will pick up on it and you will not have a good conversation with that older adult. You want to ask the client if a family member can be present to help the client remember or participate in any client teaching. And you want to have instructions that may be in their native language, nonverbal methods of communication, instructions that are in their home language if they don't understand English. So a great example, in the hospital, we use interpreter services. It is a phone service that we use. It's very easy to use. We hit a button on the phone and it links us to an account, asks us which language we need, and then we are directly connected to an interpreter that will go back and forth between myself and the patient, and we will have a great conversation, communicate, and the patient won't feel frustrated because they're able to express their needs through an interpreter and I can understand. So it's highly effective for communication. You want to be aware if the client wants to make decisions or would defer to a family member. And then again, you want to demonstrate new skills, use the teach back method, or have a client repeat. And often the older adults in the hospital will want a family member with them to hear the instructions as well. So the caregiving of older adults, there is informal support and formal support. And there are many socioeconomic factors that influence or alter families' retention of traditional values. So that means basically many families used to have a female caregiver take care of the older adult in the family. But now, due to the way the world is, many households need two working adults. Therefore, there's no one to take care of the older adults in the family. So what are your options? Formal support will include home health workers, visiting nurse services, hospice care, adult daycares, therapists coming to the home. And informal support will include family members, neighborhood volunteers, a meal delivery service, and the older adult may also have a different type of support, as in supporting their family members by taking care of the grandchildren, and they may receive support and assistance from other family members when doing this. So my grandmother watches my children for me while I'm at work or when I'm at school, but it is expected of me to help her out when she needs it. So If she needs to go to the store, if she needs help around the house, I'm there to help her. But she is getting older. She's in her mid-70s. So she is fortunate enough to have a younger sister who is able to keep up with my kids since they're so young, and help my grandmother out. But they wouldn't have it any other way. They prefer to watch my kids rather than me putting them in a daycare. So I'm very fortunate in that sense. And I'm happy to reciprocate to my grandmother in any way I can, if that means just going to the grocery store for her. And so there are some dimensions of social support. Affective support is expressions of respect and love. Affirmational support is endorsement for one's behavior and perceptions. Tangible support is receiving aid or physical assistance. But there's also losses of social support that you need to be aware of. There's separation from immediate family members, age-related segregation, the loss of a spouse or a partner. That's a huge loss of social support. And the loss of leisure activities due to either illness or income. And studies have shown that sufficient social support has a profound effect on quality of life in a positive way. Now, speaking of families, culture also influences the family structure. So there's the linear structure to be aware of, and this is when the adult children assume care for the aging parents, and then the grandchildren will assume care for the parents, and that's just how the cycle will go. For collateral structure, this is immediate and extended family friends. They receive and provide informal support amongst each other, and the reciprocity is expected. So your text has an example for the collateral structure. So in Irish, Polish, and African American families, they expect to receive and to provide informal support, amongst all of their collateral contacts. And it is expected that the relatives must assist each other when needed. And so there's just an agreement that there's this generalized reciprocity. You do want to be aware of the socially isolated older adults. They are the ones who don't see the doctor due to their lack of income or lack of social support. And when they finally do seek care, it's usually they're very, very sick and they need more extensive care. And it's imperative that nurses assess this factor. So there's also variations amongst cultural groups. When you look at the large older Hispanic groups, you'll see Cuban Americans are likely to gather with friends, while Mexican Americans will attend church and speak with their children daily. In the Asian American community, older Koreans wish to live independently from their adult children and may socialize at church, but are more likely to be isolated than those of the Chinese, Japanese, and Filipino culture. So as a nurse, you want to look for opportunities to support older immigrants, help their self-esteem and their feeling of belonging, look for ways to incorporate their home country into their new life. With that being said, older adults need their basic needs met, just like the younger and middle-aged adults. So this includes safety, security, maintaining dignity, fulfillment of integrity, self-actualization. So participating in meaningful activity contributes to this positive fulfillment. And it's intertwined in where they reside, and we will get to that in a minute. Those they may reside in community or institutional settings, and regardless of where the older adult is, the nurse should always look for resources to promote optimal functioning. Faith and spirituality. Religion and spirituality plays a large part in many older adults of different ethnic backgrounds and lives. So the following is examples of different ethnicities and cultures. These are listed in your text. And just know that the increase in religion or spirituality, this is emotional support. It could be a psychosocial resource or a coping mechanism for the older adult. So older African American women and older Black Caribbean women are more likely to experience spirituality and attend church. Japanese American state religion brings them peace. Thai elderly attending temple that says that it helps them to find the meaning of life. And Koreans relate religion to greater life satisfaction. In the hospital, it's imperative in our admission assessment that we evaluate whether the patient needs religious or spiritual requests, and we fulfill them. And we have a large chaplain service, which is a variety of people, non-denominational, Roman Catholic priests, rabbis, and they will come onto the floors and they will see the patients. They will see all the patients. And often when somebody is in a religious need, if they're feeling, so sick that they need to grasp on a religion, it doesn't matter who comes in to see them. It's them meeting their spiritual needs. So there are 3 levels of continuum of care. The intensive personal health service, health maintenance and restorative care, and coordinating of nursing and social services and ancillary services provided on an episodic basis. So public health goal is to promote wellness as a younger adult to minimize the occurrence of chronic conditions as an older adult. As we mentioned earlier, 2/3 of older adults have multiple chronic conditions, and a large part of our healthcare budget goes towards those adults. So, older adults and where they reside. They can reside in their own home and have family members assisting them. They can live in an assisted living facility, or they can live in a skilled nursing facility, long-term care, otherwise known as a nursing home. And there are many factors that go into choosing where this older adult will need to reside, such as, can the family take care of them at home? Is skilled nursing facility available? Is it acceptable to the patient? And is it affordable? As a nurse, you should take into consideration the older adult's feelings towards where they reside. Some express resignation, while others are accepting to the changes in their lives. If there is strong informal and formal support available to the older adult, they may remain in their community setting for a longer period of time. So when a client enters a skilled nursing facility, nurses should be aware of the older adult's preferences, such as their schedule, routine, food preferences, and choices for daily care, cultural background, and interaction with family members. And this will help to maintain their quality of life and help maintain a feeling of independence. If there is a terminal illness, nurses play a big role in preparing the patient for hospice, which can be carried out either in a facility or in their home. Often in the hospital setting, we will get older adults who are very regimented at home. So they take their medications a certain way, they eat their meals a certain time, they get dressed for the day at a certain time. But in the hospital, we go by the hospital schedule. So meals are not always at the times the patients usually eat. And the pharmacy schedules patient medications for certain times around the clock. So the patients may not take their meds at those times. These things add to frustration and feelings of lack of control in their life. So one way I try to assist that frustration, to lessen it, is if it's a medication time, I will call the pharmacy and I will say, hey, can we just switch this to this time? This is the patient's preference. It would make their stay easier. And generally, it's not an issue. And then you would communicate that to the patient, and they're usually very, very happy. Long-term care. You need to assess the client for the best option. And by doing this, you want to check out their mental orientation. Are they confused? Do they have dementia? Their physical and mobility restrictions. Do they have difficulty walking? Do they need to use a walker or a wheelchair? The degree of assistance with their activities of daily living. So are they, do they need somebody to bathe them? Do they need someone to take them to the bathroom? Or are they incontinent and you want to evaluate the frequency of that incontinence? And you also want to look at the level of risk for accident or injury if living independently. We don't want patients falling, because oftentimes if they don't have strong informal support at home and nobody's checking in on them, you will get patients that have fallen and laid down on the floor for 2 days. That is a common scenario when older adults are brought into the hospital. So you definitely want to assess this. In the hospital setting, there are many team players that help to determine the patient's needs upon discharge. While you as the nurse are consistently with the patient, you are their advocate and can relay this information to the case manager, the social worker, physical therapist, the physicians, and this ancillary staff will work together with the family and the patient to ensure that the patient is safely placed upon discharge. And so finally, there is community-based care, and there are formal and informal networks of services. We have the adult daycare programs. This has increased in the last 2 decades, but has inadequate funding. But these are great resources. There is an adult daycare in the community in which I work in, and it's an excellent adult daycare center. They do many, many activities that add to a feeling of, the adult it's a positive fulfillment for them. You also have the local division of aging, and usually that is within the county in which that adult resides, and they, if you reach out to them, they have a lot of options for support services for the older adults. You have church affiliated agencies. So one of the churches in my communities has a huge parish nursing program, and it's volunteerism, and it's a volunteer caregiver, and they go and assist the older adults in their community. And lastly, you have these assisted living retirement communities. They are very costly and not covered by Medicare. In my hometown, they have built this huge community called Lantern Hill, and it is a large facility in which an older adult will move into with their spouse or by themselves, and they'll first move into the first stage, which is they're still independent. They go about their daily life. They live in an apartment. Then, as they're if they're losing some independence with their functioning, they can move into higher levels of care within that building, within that community. It's really something. So then they would move into assisted living. And then from there, when they're completely dependent, they may end up in the skilled nursing facility. Not everyone can afford this type of living. Generally, if the older adult is choosing to live there, they're paying a large amount of money, and pretty much giving up many of their assets because this is it. This is where they're going to live the rest of their life. So with that being said, that's the end of the chapter. I have questions written here because I was ready to take them from you. Can't really do that online with a pre-recorded lecture, but I am going to ask you to take 5 minutes to complete a few multiple choice questions. If you can copy and paste the link that is right here. Ooh. Let's erase that. If you can copy and paste this link in your browser, it will bring you to a site where you'll enter your name and your email. I don't necessarily need that, but I need you to do that to get into it. Just answer the 5 questions. It will not count towards your grade for Dr. Wilt's course. It's only for my information for my project that I'm doing for school. And thank you so much for letting me do this lecture for you.